Welcome to the Dr. Bergson's Best Health Radio Show. In this crazy time, and maybe in all times, it's a really good idea to have kind of a sacred space where you can go. I love the lake behind my gym. They actually have a round quarry lake that people join that gym that are triathletes to practice the swim part of the competition in that lake. But actually, some of you might remember that one of my little sacred kind of odd spaces is the double doors walking into the post office. For some reason, everybody seems to be nice in that little space. So in COVID, when I finally started venturing out into the post office, once again, everybody is so nice. They hold the doors open, they say hello. And I commented the other day, I like to come here just to get this good energy in this little tiny space. And a woman started talking with me, agreeing that she'd noticed it, but not thought about it that way. But it was cool now that she really had that idea in her head. And then a guy started in with us, and there was 3 of us talking, socially distancing, but sharing that awareness that in that space, there was mindfulness and thoughtfulness. I think that's what sophisticated emotional IQ is that you have awareness of other people. It's not just about you. When you're an infant, you're all about you. You haven't individuated from your family at all. And so it's really mind-boggling to me. There was this ex-talk show host, Chuck Woolery, and he went on a rampage on Twitter last week. Everybody's lying. The CDC's lying. Doctors are lying. The Democrats are lying. There's no such thing as COVID. And Trump retweeted his tweets. And a few days later, one of his sons got COVID, and that was it. His Twitter account was taken down. He put out an apology, said this is real. Now, why did it take happening to him to say it was real? A young girl just today, a story was told about a 24-year-old girl, a Caucasian girl who got COVID and has just successfully overcome it after 80 days in the hospital. And the headline of that story was, I wish I'd worn a mask. So why do we have to go through so much to realize that there is this global isness and a cultural intermingling, and that the people that seem to have the most lubed auras, so things don't get sticky with them and they don't get so reactive and blow up, trigger happy at hardly anything, are people that have that awareness that everything's connected and we affect each other. Why do these things need to happen? One other thing I want to ask is, before I go to the topic of the show today, which is hormones and COVID, does estrogen protect and do androgens not protect? We're going to chit-chat a little bit about that. So I have a patient that was a wonderful person, just a wonderful person, that has a 4th recurrence of a hormonally driven cancer, serious life-threatening cancer. And stage 1, thank God, through all 4 episodes, just had the 4th recurrence. Finishes chemo, within a few months later, gets another recurrence, has more chemo, the same chemo, has another recurrence. Has more chemo, then in a very short time, 2 to 3 months, has another recurrence. And now she has her 4th chemo, and they're giving her more of the same. She's having her 4th recurrence. They're giving her more of the same chemo. So insanity is defined by Einstein as doing the very same thing over and over again, but wishing, hoping, whatever for a different outcome. And I don't know why very smart docs that go all the way through school and become cancer doctors aren't taking a look at the bigger picture, aren't reading about stem cells that drive most recurrence, and aren't saying, is there some other effective therapies? Is there some different way of looking at this patient who the same thing that we do is bringing her back to us? Very upsetting to me. So we had a session, and it was one of the telemedicine sessions after we got our HIPAA-approved telemedicine platform. You can't just use Zoom through the clinic. And I just said, I want to spend an extra hour with you. There's no cost. She was just a sweetheart. That's the other thing. You know, you really want to get something out of a doctor. You really want them to help you. So if you're sweet, it's easier to serve you. But if you're abusive, it's very hard to serve you. And you could have several different paradigms of patients in the same day. But she was so adorable. I wanted to put her in a Chinese take-home carton and take her home with me. So I was pulling everything out of my cabinets and refrigerator and vitamins and showing her everything, because it was an honor to serve her, and together to try and look through different portals to try and make her remission our mission, and not look at it through the same exact chemotherapeutic intervention. So, these are things that I bump into in my life, and they make me think, why aren't we thinking? And that's because we're on a money train, and it doesn't pay you any more money to think. I had a very good friend who was an oncologic doctor, and he discovered that if he gave patients chemo light, I always refer to it, where he tapered them up in smaller doses of chemo, he only got reimbursed the same amount for the chemo intervention. But it took him a lot more time. He had to his nurses take the chemo out of the bags and put less in one bag and a little bit more in another bag. So he tapered up and he tapered down, and they never lost their hair, and they had a much higher quality of life because he had some agile thinking, like, what can I do to make this chemotherapeutic experience less dangerous and less horrific? And he did, but he doesn't get any more money for it. And so most people aren't going to want to put out the energy if they really don't get any more money for it. It's, and just some basic things like the drug leukovorin was invented for people who are going through chemo to help hold folate in the lining of the gut, because it has so much to do with supporting the immune system. Methylation has a lot to do with immune modulation, and 70% of your immune system is the gut wall. So some very smart oncologic researchers created this drug that's not very expensive called leukovorin. And when you're going through chemo, and we also use it in functional medicine for other people that have methylation defects, and giving them methylated B vitamins isn't an answer for them. So there's all kinds of uses, but it was designed for people going through chemo to try and protect their gut wall, where most of their immune system is. So this person is going through a 4th round now, and it's like triple the amount of chemo visits and the amount of chemo, and no one in all this time of the 4 recurrences going to the same place and making friends with all the doctors and the nurses. You can imagine they're hugging her when she comes in and giving her that big glass of sugary orange juice, which she knows she's a very smart person. She's not taking, but no one had even recommended leukovorin, which is a mainstream medication to help optimize your nutrition while you're going through, and she's on her 4th hugely numerous rounds of chemo. So it makes me angry. I want to grit my teeth to powder when this kind of thing happens. So I just want to share with you, you have to think when a doctor tells you we got it all with surgical or chemo or radiation interventions, good, they got it all with that portal, but that's not the only portal. You want to make your remission your mission. So you want to learn all kinds of things so that the biological terrain that allowed the disease to take place in the first place, you kind of get some idea of what the glitches were so you can shore them up. So God willing, from my lips to his ears, you don't get it again. Anyway, I feel very strongly about that, but let's talk about hormones and COVID. I had a happy hour Zoom meeting with a bunch of my favorite people on the planet, compounding pharmacists, who are some of the true healers on the planet. Really, I don't know. I think maybe if I had to do it over again, maybe I'd become a compounding pharmacist, but they're much better at math than I am. But we started to discuss during that time 3 studies that were being done, giving males and menopausal females who don't have much estrogen, giving both males who have less estrogen than premenopausal women and postmenopausal women who have less estrogen than premenopausal women, giving them estrogen and or progesterone replacement, because people have been noting that it's not that way everywhere, but it looks like men are a bit more susceptible to COVID as an incidence disease and also as a mortality outcome. So that's very interesting. We don't totally know. So people are looking at COVID every which way because it's only been a little under 5 months. So across the world, we thought in China, maybe it was because when I wrote about my COVID article in April, that men there smoke so much more than women, and smoking damages even more the ACE receptors in the lungs and in the gut. And you have ACE receptors in a lot of organs like the kidney. And COVID, the spike protein, likes to bind into the ACE receptors. So we were thinking maybe it wasn't really that they were men, but that they were smokers. But Now people are thinking, well, maybe there's more to it and maybe hormones have to do with it. It's been suggested that estrogen might be protective against COVID in females and that androgens like testosterone might worsen potential risk of infectivity and of mortality in men. Now, androgen sensitivity would explain severe cases in female patients who present with metabolic syndrome or polycystic ovarian syndrome, or who are using birth control methods that include the use of hormones and bind to the androgen receptor. So there's all kinds of situations in which people have different expressions of hormones. So it's not all women. For example, young girls with polycystic ovarian syndrome have a lot more male hormone. And women taking birth control pills also have hormones. The synthetic progestins tend to bind to the male, the androgen receptor. So the thought is, well, is being a woman, because she's got estrogen, progesterone, is that protective? So physiologic hormones such as estrogen, progesterone, it appears, the theory, everything's just unfolding. We don't know. We're looking at it. We're just teasing it apart. It looks like estrogen, progesterone can bind to spikes on the coronavirus, which may interfere with these protein spikes being able to bind into the ACE receptor. So it might be that progesterone and estrogen are anti-COVID agents, maybe for people with a high risk of cell stress, like the elderly and cancer patients and people with type 2 diabetes and frontline medical care staff workers. We don't know. We're just kind of thinking about it. So doctors were thinking about this. Does estrogen protect? And so doctors at the Renaissance School of Medicine at Stony Brook University in New York are actually in the throes of a randomized trial to see if the use of a transdermal estrogen patch for 7 days in patients with COVID might reduce the need for intubation in men and women, postmenopausal women infected with COVID. And so that's pretty interesting. And looking at progesterone isn't just made by an egg bursting at when the follicle comes out in the middle of the menstrual cycle, called the luteal phase. It's also made in the nervous system and in the brain, in a wide variety of places. And forward-thinking neurologists have pondered if progesterone is anti-inflammatory. And for about the past 15 years, they've been giving 200 milligrams of sustained release progesterone to young kids with autism and people with MS with the sheath of the electrical wiring, the myelin sheath damage. And they've been using high-dose progesterone as an anti-inflammatory and to calm the neurologic system down. And we now know COVID has many faces, like the many faces of Eve. So it's a vasculotropic hormone, which means it attacks the blood vessels, and it's also a neurologic, where it can affect nerves and brain and cause more strokes. Even young people are getting strokes. So there's all these different things. So people have been saying, well, maybe progesterone might be a tool here. So many of the sickest people with COVID have high levels of immune system proteins called cytokines. That's the cytokine storm, when an immune response is overactive in retaliation to a viral infection. It's one of the most devastating complications that sets everything spiraling downward for very severe COVID patients, where the body starts to attack its own cells and tissues rather than just fighting the virus off. So cytokine storms are known to happen in autoimmune diseases during certain kinds of cancer treatment, and can be triggered by infections, even like the flu. So one study of patients who died of the H1N1 influenza, for example, found that 81% had features of a cytokine storm. So researchers were saying, well, progesterone has been used by some functional docs and some forward-thinking neurologists, and there's a lot of papers. There's a lot of papers on progesterone and also pregnenolone and also the metabolites of progesterone being anti-inflammatory and neuromodulating and beneficial. And pregnant women who usually have very high levels of progesterone tend to go into remission of autoimmune diseases, and they tend, if they get COVID, to have milder cases. At least that's so far what's been observed. So there's also a study beginning that will assess the use of a short-term course of progesterone therapy in hospitalized men diagnosed with the novel coronavirus. Now, you can give progesterone to men. When we thought for a while that progesterone might be helpful for brain trauma patients, this was observed by an ER doc, a real smart ER doc named Dr. Wright, and he noticed that women who had a brain injury during the high progesterone time of their menstruation, which is the middle of the phase called the luteal phase, because it's made from the corpus luteum, so it's called the luteal phase. And actually, oxytocin and progesterone actually are burst out of that corpus luteum. And so they did a study, a multi-centered study, I think it was about 21 different centers, where they gave IV 400 IUs of progesterone to men or women that came into the ER to see if they could get a statistically significant positive response in a randomized multi-centered trial, which would be pretty intense, and they didn't. Some people are benefited. If we have patients with stroke, we do recommend progesterone, but across the board in that randomized trial, it did not hold out. But what they found, it was very safe to give these high doses of progesterone to men. They were giving very high dose. They were giving it IV. So, and in multiple sclerosis studies where there's a lot of positive benefit, they use estriol, another pregnancy hormone, that's considered anti-inflammatory and immune modulatory. And part of the reason that women with a variety of diseases tend to go into remission during pregnancy, because estriol is high, so is progesterone high, and they tend to be calming, anti-inflammatory hormones. And so in MS, there have been a number of studies where they've given estriol and testosterone to men and women both, and had regression of plaque lesions in the brain and improvement in quality of life. And when I combine that with a variety of other things, people who had very sustained flares with autoimmune disease now would only have it for a day or two. It's obvious, it's very replicatable and repeatable. And now lots of people have given estriol to men, even though it's an estrogen and a pregnancy hormone. And there's lots of studies giving progesterone to men. It's essential that if you are a postmenopausal woman, that you continue your hormone therapy, and that hormone balance is optimized to potentially reduce your risk of serious consequences of COVID. So if you're on hormones, good for you, and stay on them. Yep, I'm staying on mine. And there's also another study where they started taking a look at why coronavirus hits men worse, and does it hit bald men worse, because bald men tend to have higher levels of androgens and higher levels of the more powerful testosterone, dehydrotestosterone. So testosterone, all hormones are made, then broken down, and then rinsed out of the body. Made, broken down, rinsed out. And the broken down part are metabolites. So testosterone goes to the next metabolite called DHT, and that's higher levels of DHT are linked with a higher level of baldness. So people are taking a look to see, well, do men who are bald have a higher rate of COVID? And does it really come down not to the baldness, but to the hormone, the etiologic hormone underneath all that? That's what we're really, probably a lot's going to come down to genetics of why somebody can be hit by it and someone else not. I was going to go over the 4th of July to some friends that have a home on Cape Cod, and I've been in here by myself for months, and I was very, very careful, and I was ready to do it. And they had some dear friends, 2 brothers, that just flew out to a wedding and did everything right and was very, very careful. And within a few days, one brother got sick, and 2 weeks he died, and the next brother several days later died. 2 brothers within several weeks died that were close friends with my friends with this house on Cape Cod. So they said, please don't come. Do not come. So, I didn't get out of the house. And so I've been reading all this literature more and more and more, and taking breaks on my rowing machine. So a constellation of ideas are coming out of why some people are more susceptible. Why those 2 brothers? They probably have some kind of genetic makeup that allows that ACE receptor to nestle on to receive the spike protein of the coronavirus. Their genes are just welcoming genes. They're non-designer genes. And people are taking a look at type A blood. Does type A blood, which already makes you more prone to ticks and mosquitoes, if I go somewhere, I'm bit up all over the place where someone else isn't. And is type O blood more protective? But I don't know. We're just taking a look at trends, at the constellation of emerging data to understand what's going on and how hormones and the genes that they regulate and how all this is affecting everything. And preliminary observations from Spain, that's where the first bald observations came from, suggested that a disproportionate number of men with male pattern baldness, now there's some women and young girls that have polycystic ovarian syndrome because of the high testosterone, tend to have a vulnerability to male pattern baldness. But it's linked to powerful androgens. In Spain, they noticed that these men ended up in hospitals with COVID, and so they were rushing to try and test approved drugs that block androgen's effect if testosterone was part of it, trying in the hopes of slowing down the virus and helping people out. And, everybody is chasing for a link between estrogen, progesterone being protective and androgens not. And epidemiologic data from all around the world have confirmed the early reports of male vulnerability. In Lombardy, the city of Lombardy in Italy, men comprised 82% of 1,591 patients admitted to an intensive care unit in a short period of space. That was published in the Journal of the American Medical Association. We used to call it JAMA. We used to call it the Pajama Journal. And male mortality rate exceeded that of women in another pajama study out of New York, looking at almost 6,000 patients. So everybody's saying, does this have to do with hormones? And one of the studies, one of the researchers was saying that there was a certain enzyme and that COVID relies in part on this enzyme, TMPRSS2, a membrane-bound enzyme, and this enzyme cleaves the spike protein on the coronavirus surface, allowing it to fuse more. And they'd done research on this enzyme in the prostate cancer research community. And so now they're even looking at a TMPRSS2 mutation to see if this revs up the ability again. It's all about letting that spike protein in. Come on in, because I got issues in my tissues and I'm going to let you in. And they haven't really established that androgens control the same TMPRSS2 transmembrane receptor in the lungs, but which is, of course, where COVID first goes from the nose down through the throat into the lungs and then disseminates through the rest of the body. So the ground zero is the lungs. But they're taking a look at all of this to see if they can come up with some kind of protective treatment. In one Italian study, men with prostate cancer who received drugs who suppress androgens and might have worked through that transmembrane receptor were less likely to be infected with COVID. So, we're looking at all these different things and trying to figure out how we protect ourselves better against getting it and how we lessen the load of the virus if we do. So, if you are on hormones and you're a woman, please stay on them. And there is a promise down the road, we don't know, of anti-androgen therapy, but we just really don't know yet. But it's very interesting to see this gender bias in this viral presentation, and we will see as things unfold. So that's been my little story of hormones and COVID. I just think it's really important maybe one of the things that we can get out of this, because it's so hard for a lot of people to say, we're all in this together. And they go, no, we're not. No, we're not. I was writing when the Michigan Lansing, the guys went into the state capitol and they had swastikas and nooses and assault weapons and grenades, which is very offensive to me, those symbols of slavery and of genocide. And I said that, and people said, you're not a Michigonian. I said, well, I went to the University of Michigan. Oh, that's like, that has nothing. That's like a communistic city in the middle of Michigan. I mean, everyone's just wanting to fight. Reactivity is the sign, the emotional fuse. It's a sign that you're not congruent inside yourself to calm down, see the bigger picture, and have a discourse. Talk about it, deal with it. But when you're reactive and you're angry, that's what causes divorce. That's what causes abusive relationships between kids and their parents. It's what causes a lot of woes in the world. So here's the time for us to take a look at our own reactivity and get a handle on it, because being more grown up, appreciating the whole, not just you, adds to much more of the calm than the shrill. And right now, the shrill is so resonant and loud and chaotic and frustrating and, frankly, in the eyes of the world, embarrassing. Please, I would love to know. Write me at information@drlindsayberkson.com and tell me how you think you've learned better to contribute to the calm, not the shrill, from this whole experience, or what other people might do better. I would really like to know. Besides, I think my lipstick is all messed up from wearing masks. It's hard to wear. You can't wear lipstick with masks, and half the time I forget because I'm a lipstick kind of gal. I wish you all the best. Be well, be mindful, and have some fun too, because vitamin F is quite important. Bye-bye.